of my lip, see the difference in color between my skin color and the color of my lip? That border is called the vermilion border. The vermilion border is clear. Now, next thing we're going to talk about is the gums. Now, for your benefit, the gums with your stick are pinkish red. They should be moist. A lot of potential for lesions there. Now, based on your reading, what are some of the potential lesions that you might find in the mouth commonly? Now, you probably have heard of canker sores. Okay, the correct name for that is aphthous ulcer. Aphthous ulcer with two H's. Oh, A-P-H-T-H-O-U-S. Yes, aphthous ulcer. Now, sometimes we'll find herpetic lesions, like herpes simplex virus 1. Now, remembering from integument, how do herpes viruses present? Grouped vesicles, right? Grouped vesicles. And it can cause shallow ulceration when the vesicle tops break. And those hurt like crazy. They can be on the tongue. They're mostly in the buccal membranes, the mucosa. So what we're going to say about the mucosa is they're moist, they're pinkish red, and then let's talk about the teeth. Now, some of us have had teeth removed to accommodate our molars. So you can basically tell me if a person has a full set of adult dentition or if there have been any extractions. So decide that today with your partner. Now, moving on to the tonsils, I'll show you a slideshow. You're going to be able to grade tonsils in just a few minutes. Now, you're going to ask the person to say, ah. Now, does anybody remember what cranial nerve you're simultaneously testing?
Facial.
When you say ah and the uvula rises?
7.
It's 10. Good for you. Okay, now, even if it was by accident, that's okay, because you got it right. Now, what we normally do is we then comment on the ducts. You've got some ducts in your cheeks, opposite your second molar, superiorly, and ducts underneath the tongue. So those are Whartons and Stinsons. And then we confirm the hard palate is intact, the soft palate is intact. Now, since the person already said ah when you graded the tonsils, do we have to go back and do it again? Of course not. What I would like to do is assess whether or not this person can swallow. Now that actually involves 9 and 10. So have the person swallow and palpate the upward movement of the larynx. You can feel that upward movement. Now, another way of kind of evaluating 9 is to have the person cough. Not on you, but to the side. Okay, good. That's it. Neat.